everyone. Good to see you all on today's Wednesday chat again with your fertility specialist. On behalf of our hospitals, we welcome you to another exciting episode today. Yes, today we're talking about laser hysteroscopy. Laser hysteroscopy. I know a lot of you have seen our flyers right now. So about starting, call up someone, share the link with someone. Just make sure you're not watching this alone. If you have your colleagues seated by you, just make sure they are also joining you to get just what you're about to get this afternoon. I'm your host, Ruth Ogogo, and I'm always excited to be with you. By the way, I would love to say compliments of the season. I think this should be next week Wednesday, we'll be saying Merry Christmas. But in the spirit of Christmas, we are also saying compliments of the season from us here at Alps Hospitals. Today we have Dr. Kenneth Eguda. A lot of you must have heard a lot about Dr. Ken, and yes, you have him right here with you today, and he's going to be talking about laser hysteroscopy. He's an IVF specialist, he's a consultant gynecologist, he's a minimal access surgeon. As a matter of fact, that's what he's here to talk about today, minimal access surgery. So there's just a lot that he's ready to download right now. So make sure you keep your Bluetooth, your Zender, whatever platform you want to use to download this right now. Just make sure you have it all open so you're able to download as much as you can. Dr. Ken, it's good to have you. You're welcome.
Pleasure.
Yeah. So as we get started, sit back and enjoy the show. Drop your comments, your thoughts, your opinions in our comment section, and we'll definitely attend to your questions and every of your comments. Thank you once again for joining. So we're talking about laser hysteroscopy. Hope I'm pronouncing it well because I'm a layman. So I don't know if I'm pronouncing it well, but yeah, maybe you should tell us a little about
No,
history.
you rather mean you're talking rather we're talking on laser hysteroscopy enhancing fertility.
Yeah.
Yeah, so I think that's basically what we're talking about. How
Yes.
laser uh, will enhance
Fertility.
fertility. I mean conception and all the other things, and that is how it compares to other gadgets that are
Mm.
used for hysteroscopy.
Yeah.
Yeah,
So maybe before we talk about the laser, maybe you should tell us a little about hysteroscopy.
yeah. Hysteroscopy. It's just the use of a telescope, you to view or inspect and possibly treat abnormalities that are found in the uterine cavity. Now, the uterine cavity, in my opinion, is the most important aspect
Mm.
of the female reproductive organ. Yeah, I think it's more important than the ovaries.
Okay. Oh wow.
Yeah, I think so because without the uterine cavity, pregnancy won't happen. Without a healthy uterine cavity, there's little or no prospect to having pregnancy, to getting pregnant.
Mm.
But without the ovaries, you can still get pregnant. You know,
Yeah, that's right.
so that's why I say it's the most important.
Mm.
And as an IVF specialist, my observation is that aspect of the reproductive organ has a lot of challenges with it. A lot. That is where we put the embryos when we fertilize them. That's where we keep the babies. That's where the
Mm.
baby grows.
Yeah.
And that's part of the woman reproductive organ that sheds at menses at the end of every month of a menstrual cycle. So hysteroscopy means just inserting the telescope
Okay.
into the uterine cavity
Mm.
to view,
Okay.
for possibilities of abnormality or normalcy,
Okay.
and also with the intention of correcting any abnormality that may have been seen or that could be seen during the process. So you use water. It's attached to some channels of water,
Mm.
and water distends and
Mm.
opens up the
Okay.
uterine cavity, and so you're able to view, see under
Mm.
direct vision,
Yeah.
HD a lot of times,
Okay.
and then you're able to tell whether the uterine cavity is normal
Mm.
or abnormal.
Yeah.
So, in a nutshell, that is what hysteroscopy
Yes.
it's all about. And when you find abnormalities, for instance,
Mm.
you could correct the abnormalities with any form of instruments that you have. The instruments could be mechanical instruments without the addition of energies to them, and then it could be with advanced instruments. I mean, instruments that have energy sources attached to them.
Mm.
And I think that's what we're looking at, all the different energies and how they compare with themselves
Yeah.
and how they either hinder or enhance fertility. And
Fertility.
that's where laser comes in. So
Mm.
in a nutshell, that's what hysteroscopy is all about. And for me, of all investigations actually done during
Yeah.
fertility treatments,
Yeah.
I think I find hysteroscopy very interesting and a lot more necessary and a good number of them, because at the end of the day, that's where you keep the babies,
Yeah. That's
and
true.
then you would like that the place is normal
Yeah.
or near normal,
Mm.
and have an idea what it looks like before putting the babies in there.
Okay, so you've told us a lot about hysteroscopy. Are there people, who are the people that you would recommend hysteroscopy for before we now talk about laser hysteroscopy as the pathway to enhance fertility?
Okay, so there are a lot of reasons why hysteroscopies should be carried out before an IVF treatment cycle, you know, or even for those who don't intend to get pregnant. A lot of reasons why hysteroscopies should be done. Or maybe let me just put down my biases a bit
Okay,
and talk about the woman generally.
okay,
A lot of reasons why a woman should have hysteroscopy.
mm.
And I want to start from the advanced age woman, for
Okay,
instance.
okay,
Let's say you have a woman who has stopped menstruating,
mm.
then all of a sudden she starts spotting,
Mm.
and shows some bleeding and all of that. And investigative modalities not really conveying what exactly is going on with this woman. Okay,
Mm.
so you may want to do a hysteroscopy as part of our investigation to see
Okay,
whether there are reasons why she should be spotting or
mm.
bleeding at
Mm.
that age when menstruation has apparently stopped. You may find out she has a
Mm.
polyp, or some form of growth in the uterine cavity, and with
Mm.
that hysteroscopy, you could actually operate her
Okay,
and take care of that.
mm.
So that's one reason why they could have. And even when young ladies are having abnormally or excessive bleeding,
Mm.
you know, this is not necessarily related to pregnancy
Yeah,
or not necessarily related to desire to be pregnant.
yeah.
You may want to do hysteroscopy to find out what's really causing this
Causing
bleeding.
it.
More so
Mm.
when the cause of the bleeding is not easily detectable by an ultrasound scan.
Scan. Mm.
So hysteroscopy could tell you why she's having abnormal bleeding. And when somebody stops menstruating too,
Mm.
why she should be menstruating. You may
Yeah.
also want to do an hysteroscopy to find out why she stopped menstruating, because some form of problems may have arisen in the uterine cavity that may stop her from menstruating. So you want to
Mm.
just be sure why
Yeah.
this is all happening. Okay,
Mm.
so that's for people who are having either excessive bleeding or no bleeding, or bleeding at awkward ages. You
Yeah.
want to do hysteroscopy. So now, back to fertility.
Yeah.
There are a lot of reasons why women desiring to be pregnant should have hysteroscopies. The common reasons, maybe women who have had a D&C before.
Mm.
D&C. I know the procedure for D&C is like scraping
Mm.
the wall of the uterus.
Wow.
You know, you scrape the healthy wall of the uterus
Yeah.
and the alongside where the baby is attached, because you're doing
Mm.
it blindly.
Blindly.
And by the way, that's actually been prescribed. It's meant
Mm.
to be stopped. Just that I don't think some regions of the world are ready to have that transition. I'm talking about DNC,
Yeah.
you know, or evacuation.
Mm.
So in those procedures, the doctor scrapes the entire wall of the uterus. This wall of the uterus may heal with some form of adhesions.
Mm.
And then if hysteroscopies are not done, you may end up putting the baby on a scar
Yeah.
tissue, and then you have
Mm.
problems with implantation. So for
Yeah.
women who have had D and C evacuations, they may need hysteroscopy before
Okay.
an IVF treatment cycle.
Mm.
Those who have had fibroid surgeries, for instance,
Okay. Wow.
especially the open surgeries where
Mm.
the uterus is tied for a long time,
Mm.
in excess of 1 hour, 2 hours.
Yeah.
There may be some ischemia. I
Mm.
mean, some deprivation of blood and the
Mm.
consequences of all of that. Adhesions may form following that. You
Yeah.
may also want to check using a
Mm.
hysteroscope to find out whether the lining or the uterine cavity is normal,
Yeah.
before an IVF is done.
Mm.
A woman who has had previously failed IVF
Yeah.
cycles,
Mm.
and for which you're not really sure what exactly is happening,
Yeah.
you may also want to check what the lining of the womb looks like. So you
Mm.
could try to explain why implantations are not happening.
Mm.
Yes, why implantations are not happening, and whether there are things to correct, you
Mm.
know, for implantations to happen. So those are some few reasons why hysteroscopies
It's done.
could be done. And
Wow.
when you even investigating a woman that regular gynecologists think there is no cause for infertility, usually
Yeah.
they have this terminology we call unexplained infertility. By the way,
Okay.
there is no infertility that doesn't have explanation. They all
Mm.
have explanation. It's only
Mm.
when you don't know what the explanation is, you
Is.
say it's
Mm.
unexplained. But every infertility sure has an explanation.
Explanation.
So you may want to do a hysteroscopy,
Mm.
yeah, just to keep searching in case you
Yeah.
find out why pregnancies are
It's
not
not
happening
happening.
spontaneously.
Mm.
Now you could do hysteroscopy to treat some abnormalities.
Oh, wow.
You
Mm.
could do hysteroscopy to treat some abnormalities,
Okay.
to treat fibroids, to
Mm.
remove fibroids from the uterine
Yeah.
cavities,
Mm.
or even depending on the kind of procedure, the kind of energy source you have, you could do hysteroscopy to reduce the size
Oh, wow.
of a fibroid,
Okay.
to reduce
Wow.
the symptoms that the
Mm.
individual
It's
has.
presenting with.
So, a lot of reasons why women should have hysteroscopy, and it is the gold standard
Mm.
of inspecting the uterine cavity. I mean, inside of the uterus.
Yeah.
Hysteroscope is a gold standard. Every other thing you use is just a mere interpretation of shadow. Yes, and
Yeah.
some people are experts in interpreting these shadows,
Mm.
but there is no way a shadow would be as good as an HD image,
Image.
which is what
That's
you get
right.
from a hysteroscope. So it's
Strobing.
the gold standard for
Mm.
inspecting the uterine cavity. You know, um, it's like an unspoken agreement
Mm.
amongst IVF specialists
Yeah.
that a good number of women, I don't want to say all, will
Mm.
require hysteroscopy in the course of an IVF treatment
That
cycle.
was one of the questions I was going to ask you. If it's compulsory for all women to actually have that.
You won't say it's compulsory,
Mm.
but largely a good number of women should have hysteroscopy before an IVF treatment cycle is
Mm.
concluded.
Wow.
Mhm.
Okay, so we'll go to the main topic of today, laser hysteroscopy. So maybe you should tell us some more about laser hysteroscopy, how you do it, what it's all about. Yeah.
So it's just the use of laser.
Mm.
Excuse me. It's the use of laser to carry out an hysteroscopic procedure.
Okay.
So we have all kinds of energies used in surgeries, for
Okay.
instance.
Mm.
And now in hysteroscopy, you have other kind of energies used for hysteroscopic procedures.
Yeah.
Laser seems to be the latest,
Okay.
you know,
Wow.
the most fanciful.
Wow.
Yeah. Um, yeah, the most fanciful and very easy to apply in the hands of trained individuals.
Mm.
And the energy source with the least complications.
Wow.
Yes, compared to every other energy source.
Mm.
I use all the energy sources as a matter of fact. The monopolar, for those who know what monopolar is, the diatomy, the
Okay.
bipolars,
Mm.
and now the laser. And
Mm.
then this monopolar or bipolar could be attached to any kind of instrument that you could use in operating in the uterine cavity.
Mm.
The problem they have is this: if you're using it to make a cut in the uterine cavity,
Yeah.
in addition to the cut you're making, the energy spreads laterally, spreads maybe 3 to 5 millimeters on
Wow.
one side, 3 to 5
Mm.
millimeters on the other side. So it may be causing some other damages in addition
Mm.
to the help you're giving.
Okay.
You know,
Wow.
so you can imagine you're cutting on a straight line this way, then
Mm.
you have you're damaging tissues 3 millimeters away or five
Away.
millimeters away from the straight line,
Mm.
and 5 millimeters away on the other side of the
Yeah.
gadget you're using. Okay, so
Mm.
at the end of the day, you may be
More
harming the
harm than good.
tissues, and then you could have more scarring. I mean,
Mm.
adhesions, scar tissues forming
Yeah.
with the use of some of these are unrefined. They are just unrefined. They
Mm.
are unrefined sources of energy.
Wow.
They do
Mm.
good.
Okay.
You could still achieve your result with that. You could
Yeah.
still achieve pregnancy with that, but there are more side effects,
Mm.
you know, with this than with laser. The laser, for instance, is as thin as 1 millimeter itself, or at
Wow.
best 2 millimeters,
Hmm.
you know, and then there is no lateral spread of this energy to
Wow.
either side. So it only
Okay.
acts on the area you are applying it.
Hmm.
So it preserves the tissues,
Okay.
around your
Hmm.
operating area.
Hmm.
That's one beauty of this laser. You just see lights, just operating in the uterine cavity,
Hmm.
like a magical light.
Yeah.
And then it doesn't damage or char up the tissues, it doesn't burn the tissues unnecessarily. And at the same time, it cuts,
Wow.
it stops bleeding,
Okay.
and it seals the blood vessels.
Wow.
So operations with laser could just be
Hmm.
bloodless as possible. And in
Possible.
my opinion, it's very fast. Yeah,
Wow.
very fast. And then with hysteroscopy, you apply a lot of fluids. I mean, you
Hmm.
use some fluids, and because it is fast, less fluid is used, and so the
Yeah.
woman is safer having procedure with laser
Yeah.
because there's no much problems with unnecessarily absorption of fluid.
Yeah.
That could be problem to some people.
Hmm.
So that's one beauty of laser.
Laser.
That's one
Wow.
of the beauties of laser. So if you're looking at a woman who needs fertility care, for instance,
Yeah.
knowing that these other sources of energy could damage tissues both ways.
Yeah.
5 millimeters this up, 5 millimeters down. So you finish surgeries and then you're having possibility of losing about 1 centimeters
Yeah.
health
Oh.
of a tissue.
Yeah.
Then you want
Hmm.
to make the right choice for going
Yes.
for laser.
Hmm.
You know, uh, and depending on the area you are operating on, the uterus is close to the ovaries.
Hmm.
And this same energy could be dissipated to the and then you'll be passing unnecessary heat and energy to the ovaries, and that can also reduce the ability of the ovaries to produce
Wow.
eggs.
Wow.
So laser preserves reproduction better
Yeah.
than any other tissue. I mean, any other source of energy
Energy.
used. So, and
Wow.
for
So,
me, I think it's my own gold standard. It's not popular in the world right now, not yet
hmm.
popular. People are taking time to get warmed up to it, acquire it,
Yeah.
train to use it,
Hmm.
and then I think it is more of a blessing to reproductive medicine using laser than all the other sources of energy.
Yeah. So, you've heard so much about laser hysteroscopy and its benefits and how it helps to enhance a woman's fertility. And it might just interest you to know that Dr. Kenneth Eguda is one of the pioneers of laser hysteroscopy, or should I say laser gynecology in Nigeria. In fact, he's the first for laser gynecology in Nigeria. Just so you can imagine who you have, and then not just Nigeria, also East Africa. So this is just you can imagine him. He has gathered so much. He's so versatile that he has gathered so much knowledge, and then he's trying to also dissipate this knowledge to us so you can also have an idea of what fertility and laser, how it actually could be of benefit to you, so you know what kind of of treatment you are assessing with your fertility specialist, just in case you come in contact with Alps hospitals or Dr. Ken. This is, yes, what you're actually looking at getting. So someone is asking, is it possible to get pregnant spontaneously after hysteroscopy?
Oh yes, everything is possible in reproductive medicine. You may just be undergoing preparation to having an IVF,
Mm,
then poof, pregnancy happens. So everything is possible. It all depends on what's causing your
infertility.
infertility.
Mm,
And by the way, some corrections with respect to laser. I think I'm the first in Africa,
mm,
not just East Africa,
mm,
first in Africa to be trained
mm.
in the International School of Laser Gynecology in the
Wow.
world,
Wow.
and the first to deploy it in gynecological practice in Africa.
Wow.
Yes, and we made a presentation at the last AFRH conference, which is an international conference of reproductive specialists in Africa,
Yeah.
just September this year,
Mm.
where the first laser presentation was
Was
made in
made.
this sub
The
region,
word.
and then we were able to showcase about 940 laser gynecological surgeries,
Wow.
and still counting.
Mm.
So that's just for the records. Yes, and I was privileged to have been trained by the pioneers in the world themselves. I'm
Yeah.
talking about Professor Ahimovic and
Wow.
Professor Staminov
Okay.
in Barcelona and Bulgaria all together.
Mm.
And so I'm also training people around here. Trained a couple of people in Nigeria already, and then we have people flying in from India to have training, and some have shown interest from some other African sub-regions to have training in laser gynecological surgery. So it is the way to go, because anything that makes a woman's life better and increases the prospect of conception, for me, I think should be adopted and practiced. Yeah, it's very expensive, but there's no good thing that is very cheap.
Yeah.
hmm The good thing is very cheap. So a woman can just get pregnant after
Spontaneously.
any of the evaluation without necessarily having to do an
An
IVF,
IVF.
Yeah, so it's possible.
Okay. Okay. So hope that answers your question. And
Mm,
yes. So you see, in fact, I even underestimated him,
mm,
obviously. So in the whole of Africa, wow.
mm.
So there's just so much about. So I think, our dear viewers, you're watching this. Yes, a lot of centers do hysteroscopy, but now that he's beginning to train some people in Nigeria, he's still number one, because yeah, he's still the person that actually acquired this knowledge. So it means he's still best at what he does. So it means that you're also getting this knowledge, so you also know I mean, now the world is actually coming to a point where people come and then they can even request for what they want to do.
Yeah,
Yeah,
sure,
because
sure.
you want to go for a
Mm.
stereoscopy, you can also say, I don't want people to just use anyhow kind of operative, I want
No,
laser.
actually, just before coming here, we
Yeah.
just finished a hysteroscopy,
Yeah.
before dressing up to come
Mm,
for this
mm.
talk. And, she had had over 4 IVF treatment
Wow.
cycle, failed
Wow.
because she had had intrauterine synechia,
Wow. Mm,
adhesions in the uterine cavity.
mm.
And then she came in for for hysteroscopy.
Okay.
And then she kept asking, "Hey Ken, is it laser
Mm-hmm.
hysteroscopy you're going to do?" I was like, "Hey, come on, man. Can we just have some break? What about this laser?" I said, "Oh
Mm,
no, we decide what to use when we see what you're presenting for." And then she
mm.
kept on asking, because her eyes were open, she was not
Yeah.
sleeping. "Are we
Yeah.
going to have laser?" "Yes, we're going to have laser." So yeah, people do ask.
Mm.
And after the presentation at AFRH conference, for
Yeah.
instance, you have call all across Nigeria. We
Yeah.
want to have
Hysteroscopy.
laser fibroid surgery,
Mm.
laser hysteroscopy, and all
Yeah.
of that. I think the world is getting very enlightened and advanced, and they actually
Yeah.
make demand on what they want.
Yeah.
And I think it's just best to equip yourself with the necessary gadgets, skills, and ability to give people what they actually want.
Mm.
And laser hysteroscopy, it's actually the way to go.
Yeah. Okay.
Mhm.
So we have a question. Even though it feels like we've addressed this, someone is asking, when is hysteroscopy recommended? Even though I know you've talked about some people that need it.
Yeah, the recommendation is individualized.
Mm.
You know, If someone had a fibroid surgery, for instance, and is going in for an IVF, the person may be needing hysteroscopy. When you have recurrent failed IVF treatment cycle, you may be needing hysteroscopy. When you have recurrent pregnancy losses, you may be needing
Mm,
a hysteroscopy to just find out what's causing the losses. And if during ultrasound scan a lesion is seen in the uterine cavity that is not very obvious or very clear what it is, hysteroscopy may be necessary,
mm,
not just to inspect, but also to treat it, as in to operate it. So it could be
yeah.
operative, it could be diagnosed. Just depends on what you want. So there are a lot of reasons. When
Okay.
a woman reach menopausal level, I mean menopausal state, and then she start having bleeding, like a
Mm,
young girl again, she needs hysteroscopy to see what's making her bleed. Sometimes it just be polyp in the
mm,
uterine cavity,
yeah.
So there's a lot of reason why they need hysteroscopy, but it's individualized.
Yeah. So speaking of it, the way you make this laser, it looks so simple. It's is like for now. Maybe you took someone in for a hysteroscopy. Do you need to reschedule for the laser, or you could just address it right away as you're doing the
Oh yeah,
hysteroscopy?
so in ARPS hospitals, for instance,
Mm,
we go with all preparations, usually
mm,
see and treat. You
yeah,
know, that's what the society can afford for now. So we go in preparations for all possibilities during
yeah.
hysteroscopy. If we don't find anything, fine, we're out. But if we
Mm,
find anything, whether
address it.
fibroid, polyps, adhesions, or abnormal uterine cavities, we correct it immediately using the laser. If there's fibroid, we can just take out the fibroid. If it's polyp, we use a laser to take it out. If it
Mm,
is adhesions, we cut through the adhesions,
mm.
So
Wow.
it all depends. But
Yeah.
usually we go with the intention of seeing and treating.
Immediately.
Yeah.
Wow. That's nice. And that makes it easy for
Mm-hmm.
you as a client as well. So
Mm-hmm.
we have another question. How is the patient's preparation for any patient undergoing laser hysteroscopy under sedation or being awake? Are there any complications that could arise after or during the hysteroscopy? So this is more like saying, are there complications that could arise from during hysteroscopy or after an hysteroscopy is done?
Yeah, there are quite a few complications that could happen,
Okay.
with if you're talking about complication of hysteroscopies
Mm.
generally. Yeah, you could have a perforation of the uterus, for
Oh wow.
instance, but then it's a rare complication, but it does happen.
Mm.
And when it happens, you identify it, you fix it.
Mm.
So it's the most feared complications, for
Mm.
instance.
Mm.
Yeah, and with laser, for instance, you could have complication, but it's very rare. It's not very aggressive like the other sources of energy that's
Mm.
attached to metals and all of that. The laser is
Mm.
just a fiber, like a light.
Yeah. Mm.
Even if it perforates the uterus, you don't need to act on that because it's a
Yeah.
pinhole on
Mm.
the uterus. It seals immediately, and then there is no complication. As against when other sources of energy perforate the uterus, you may
Mm.
just be going into the intestines and cause some damage to the intestines.
Mm.
But laser will hardly do that. But
Wow.
it could perforate if you're not careful on your cut.
Mm.
But it just like an office pain.
Okay.
And then if you're careful with your work, complications can be minimized to largely. But the complication that may occur may just be with the insertion of the hysteroscope. Maybe you just have
Okay.
a perforation. More so if
Mm.
you're not inserting under the vaginoscopy procedure. I mean,
Okay.
processes.
Mm.
So, but then little or no complications.
Okay.
Oh yeah.
Okay. So I think someone wants to know what this laser hysteroscopy is like. Is the patient awake? Are they sedated? Is it a long procedure or it's just a very short procedure?
Often we don't sedate the patients.
Mm.
Often we don't sedate the patient. We do ours a lot under local block,
Mm.
paracervical block, for instance. But if a patient or a client demands or requests for sedation, we could
Mm.
sedate the patient. But
Okay.
our default pain block
Mm.
is to do a paracervical block,
Mm.
and for a good number of people, it's fine because you just get out of the operating room and you just walk out of
Out
the hospital,
exactly. So
or
that
just
means
have
it's a
some
very
some
brief
few some
procedure.
few minutes rest, and
Mm.
then you could go.
Oh.
Mhm.
So I hope that answers your question. It's a very brief procedure from the way
Mm,
he has described. And I
mm.
know he also mentioned that fibroids could be taken out because someone is asking, can fibroids be removed with laser?
Yeah, I think we had some video that they could show.
Mm,
Fibroids could be removed using laser.
mm,
Fibroids, laser, polyps remove with laser, and then
mm.
you have women who have abnormal uterine cavities. You
Okay.
have some growth like septum. I don't know what word to use to simplify this. Just a growth in the uterine cavity. Maybe the
Mm.
uterine cavity didn't form
Well.
properly.
Mm.
So you could use laser to ablate it, and sometimes laser just burn them off. Just
Wow.
just vaporizes some of those structures.
Wow.
So it makes it a lot easy.
Easy.
Sometimes if
Mm,
you even have the radial fiber of the laser, for
mm.
instance, and you don't even want to you cut off something, you just insert it into the structure for just 2 to 3 minutes,
Yeah.
and then it just vaporizes it.
Mm.
And you don't see the abnormality
Wow.
anymore. So it's
Wow.
just like it's just
Amazing.
like magic.
Yeah.
It works well. It's a very
Wow.
beautiful gadget to have.
So keep your questions coming. Yeah, we're seeing so much questions coming from hysteroscopy. Keep your questions coming. So Dr. Ken, what's your what's should I as I would always say, what's your final statement, or what's your commendation, yeah, to someone watching, or even a professional that's probably watching now, with regards to laser hysteroscopy as a pathway to enhance fertility of a woman?
When a superior technology surfaces,
Yeah,
the lesser technology becomes obsolete
that's
or
right.
becomes less desired. This is the
Yeah.
situation with laser.
Hmm.
And from the last talk we had in the international conference, you have quite a number of centers now desiring to acquire and to be trained
Hmm.
in the use of laser. We're beginning from Lagos.
Hmm.
We've done some in Abuja already.
Hmm.
So we will either they come for training, or if they have gadgets, they find a way to get trained.
Hmm.
I think people should acquire it because it takes better care of a woman than all
Yeah.
other sources of energy. This is not to
Hmm.
say the other sources of energy do not work or
Hmm.
don't work, but for reproduction, if reproduction it's in view,
Yeah.
laser is superior to most other sources of energy.
Hmm.
So people should train, acquire the skills, get the
Hmm.
gadgets, and give the woman nothing
For the
less than
best.
the best.
Yeah.
Yeah.
Thank you so much. It's been so wonderful having you um release, or should I say give us a downpour of what laser
Oh
hysteroscopy.
yeah.
Yeah, so I know our dear viewers that you've heard a lot about laser hysteroscopy today, and you've heard it from one of the world's best. So
Can say
I
that again.
yeah. Oh yeah. We'll say that anyway. Yeah. So would say we'll keep looking forward to your comments. We'll keep looking forward to more of you, because I, like I said, what best. So I would always look forward to seeing more of you coming to assess treatment. We're not saying everybody has to do laser hysteroscopy, but once you need it, you can trust us hospitals that you're getting the best out of it. Yeah. So thank you so much for joining today. I remain your host, Ruth Ogogo, and I look forward to seeing you next time. Bye.